presentation into different aspects. First of all, I just want to introduce myself and my team and why I am practicing in Horizon Hospital, why I choose this hospital for this purpose to practice in surgical oncology and advanced laparoscopic surgery. And secondly, I will explain all the specialties which are working here with us. And thirdly, I will answer all those questions. I will try to cover all those questions will be arise by you, that why we refer our patient to your hospital. And then in the end, we will end up with question answer. You can ask any question for us, from us. So who we are actually comprised of experts who are not only experts in their specialties, but also they are experts in other specialties dealing with advanced surgeries like oncological surgery and weight loss surgery, which are known as bariatric surgery. Our faculty, next please sir. Faculty comprises of different surgeons which belong to different specialties. Our chairman is Professor Dr. Asghar Naqvi, is leading us, followed by Dr. Huma Majid Khan, who is a breast surgeon, followed by Dr. Ahmed Uzair Qureshi, Dr. Ali Akbar, me, Dr. Awais Amjad, he is a bariatric surgeon, Dr. Sadaf Isaq is also a breast surgeon. Next please. So why I am practicing here? These are the specialties of this hospital other than other hospitals in the town, that we have the state-of-the-art operation theatres with the distinguishing features of the laminar flow. The laminar flow is a technique by which you reduce the number of bacteria in the operation theatres, which ultimately result in decrease infection rate in our patients, so it ultimately translate in a good outcome of our patients. And then the availability of advanced endoscopic, laparoscopic instruments in our hospital, and all these instruments are sterilized. They are not put in the Sidex and all those solutions which ultimately may cause infection to the patients. And the state-of-art CSSG unit, and it is established in a way that there should be one-way traffic of sterilized instruments and the dirty linen from the operation theatres to the CSSD, so that our clean area should not be contaminated with the dirty instruments. Next is the post-operative anesthesia unit and ICU, which is being dealt by our anesthesia team. And in this ICU and post-anesthesia unit, every patient is attended by a single nurse, and that nurse is being supervised by our duty doctor, and that is being supervised by a consultant, which is 24 hours available in our hospital. Next please. So the ultimate outcome, what we are showing here, that we have performed around 2000 cases in our hospital, and there is hardly any case reported which end up in a wound infection. Minor wound infections are still there, but nobody present to us with a major wound infection who require any kind of a second time of surgery or who require any kind of admission to our hospital, except there are certain respiratory complications may be present, but regarding wound complications, patient didn't present to us. So this is operation theatre, and operation theatre is showing on the top is the laminar flow system. Next slide please. This is the floor system which is actually controlling this whole movement of air in the operation theatre. Next is the post anesthesia care unit. Each bed is allocated to a single staff, and single staff is looking after a single patient. Next please. So this is a CSSC unit which has a state-of-art sterilizing unit. Next please. This is the 2 sterilized units which are available, and all this system is electronically maintained. No manual work is involved in controlling all these systems. Next please. So our expertise, we are dealing with the basic surgical procedures, we are dealing with the advanced surgical procedures. Next please. So we have a dedicated orthopedic team, we have a dedicated urological team, we have a dedicated whole system of general surgeons which are covering all the specialties. Next please. So the basic surgical procedure which we are performing are the appendectomies, hernias, cholecystectomy, diagnostic laparoscopies, perianal surgeries, excisional biopsies. All these procedures are performed open as well as laparoscopically. And in advanced procedures, we are offering colorectal surgeries, hemicolectomies, anterior sections, APRs, hepatobiliary surgeries, liver sections, Whipple, breast surgeries, endocrine surgeries, upper GI surgeries, and gynecological surgeries. And To honest, all these procedures can be performed laparoscopically. We will show you the few slides which we have performed in this hospital. Next, please. So, the important thing of our hospital that it is the only hospital in this town who has having specialized surgical oncologists working with their medical oncology team. And every patient who is presented to us, we discuss all the patients in a tumor board meeting, and this tumor board meeting is attended by medical oncologist, radiologist, pathologist and surgical oncologist. And every patient will end up in a certain plan, and that plan is based on the guidelines and protocols. And this is the only hospital in the town who is offering this service without any cost. This is our specialty. Next, please. Next, please, sir. So, few advanced procedures just to show you what we are doing in a hospital is a sentinel lymph node biopsy. I can bet you that there is no hospital in Lahore who is offering this sentinel lymph node biopsy services with dual technique except Shaukat Khanam. Next slide. These are the two methods by which we stage the axilla in breast cancer. One is the gamma probe method, the other one is the dye method. And ultimately, this dye method actually help us in locating the lymph node in the axilla. Next slide, please. Here you can appreciate the blue lines which are traveling from axilla, from the breast area to a lymph node. You can appreciate the blue lymph node here. These are the lymphatics lined by this blue dye. This is actually a specialty which we have established over time. Now we have a gamma probe, we have dye, and we are doing it on routinely basis at our setup. Next, please. So this lady present to us, she is 34 years old. She presented to us with a sigmoid colon tumor. She underwent laparoscopic and tear section in our setup. Next slide. I hope you cannot appreciate anything in this slide, but I put this slide just because of this. This is the beauty of the laparoscopic surgery, that you are not interfering with the other structures. You are working in the facial planes. You are not disturbing the normal structure. You are only operating the abnormal structures. So next slide, please. So this is the specimen which we remove with this small incision. This is only a 5 centimeter incision, and you have removed whole of the specimen. Next, please. We ultimately make an anastomosis of the proximal bowel with the distal bowel with the help of using a circular stapler. Next slide. This is the anterior line of the stapler which is being shown here. Next, please. So this is stapler which we use. Next slide. This is another slide of the stapler. Next slide, please. So this is the whole specimen. This is the whole specimen. This is the proximal and the distal donuts. Next. We do not leave our patients up till this point. We follow these patients till the end, till the microscopic level. This is a gross picture of that specimen which we cut in our pathology lab, showing a stenosing tumor here. Next slide, please. Next, please. So next important aspect of our surgical team, that we are offering bariatric surgery, which is actually a weight loss surgery. In this surgery, this is the ultimate method of sustaining a weight loss, and we are offering different kind of procedures like sleeve gastrectomies, mini gastric bypass, Roux-en-Y, and this bariatric surgery is comprising of nutritionist, a bariatric surgeon and a physiotherapist. Next, please. So this is one of the slide of our patient who underwent sleeve gastrectomy. This is the first slide. Next slide. This is the sleeve specimen. This is the gastric remnant which is left behind in the patient, which help in the loss of patient. This is the ultimate specimen which we removed laparoscopically, and whole this procedure is before laparoscopic, and this patient is discharged next day in the morning, and the patient was started orally. Next, please. So why Horizon Hospital from your side? Reason is that we are providing state of the art services. Next, because our team work as a team to operate all the patients, and this ultimately translates into a good outcome. Next is we follow international guidelines to clean, to fumigate, and that ultimately translates into a lower infection rate in our patients. And the point which is very important, this is the only hospital which is offering this. This is a paperless hospital. Every record, everything is available on our computer system. Patient just come with a medical record number. He will just show us medical record number, and the record which was saved years back, you can retrieve from the data, and you can even see the labs like histopathological reports, like X-rays, like CT scans, like MRIs, everything whatsoever. And whole system is a packed system, a packed link system. You can retrieve anything from this system. Next, please. So how we want to work with you? So any patient present to you with a general surgical issue or cancer issue or want to reduce weight, you can refer that patient. That patient will be seen by our team and will be offered surgery according to the protocol. And if the patient is operated by us and that patient is suffering from benign disease, that patient will take care and ultimately referred back to the primary physician. But if the patient is suffering from some cancer surgery or cancer problem, ultimately the patient will be followed by the specialist to which the patient belongs, either maybe surgical oncologist or maybe a medical oncologist. Next, please. Sir, thank you. But before leaving this, so another very important slide is, next please sir, any patient who present to you with a bleeding PR, any patient, any lady of any age present to you with breast lung, please do not ignore that, because we have seen that a 24-year-old male present to us, he was treated by some local, and he was even seen by our senior persons, but they did not bother to prick the finger in the anus. He was suffering from a rectal carcinoma, and he presented to us with a metastatic lesion in the, and he was treated by our doctors for 2 years, which was the time when he can be picked up properly and can be treated accordingly. And do not think that a 29-year-old lady cannot suffer from cancer. So that the age has not changed. Any person, any age can present with cancer. Thank you, sir.
After treatment for cholecystectomy.
Sir?
Cholecystectomy.
Ji, sir.
Is there any alternative instead of going the
Cholecystectomy. Fine, sir. Sir, if you go by the pathophysiology of forming this stone in the gallbladder, there is one factor which is the abnormal wall motion of the gallbladder, which is the main causative factor for development of these gallstones. Even if we remove the stones from the gallbladder without doing anything or any drug which can dissolve these stones, still that patient will have a risk of developing again stone in the gallbladder. So there is no any other treatment available except cholecystectomy for these gallstones.